Hello, and welcome to the special report with Areva Martin. Today, we are delving into a topic that is near and dear to my heart. You've heard me talk about it on numerous occasions in the past. And this is today one of the most sensitive and unsettling, and need I say, urgent debates that's happening in maternal health and autism research. It's so unsettling for me that I wrote an op ed piece for USA Today. A few weeks ago, President Donald Trump and Health and Human Services Secretary Robert F. Kennedy Jr. held a press conference. And during this press conference, they made the shocking statement that Tylenol, which contains acetaminophen, during pregnancy, if Tylenol is taken during pregnancy, they said it is the cause of autism. Such a shocking and startling statement to be made by the president and the Secretary of Health and Human Services. Now, as a mother of a young son on the autism spectrum and as the founder and president of one of the California's, and need I say, the nation's leading autism organizations that's working at the intersection of disability rights and social justice, I've always been committed to truth, to science, and to justice. And if the administration's claim turns out to be true, if a over-the-counter common drug painkiller like Tylenol is linked to autism, then millions of families may be entitled to not only answers and accountability, but compensation. Because let's face it, no one warned millions of parents, millions of women that took Tylenol during pregnancy. And have they done any studies to see if Tylenol taken by men during the time that children are conceived has any impact on the genetic makeup of children? So many unanswered questions, so much wrong about that statement or those statements made by the president and RFK. So we are here today to break it all down, to give you some true perspective about that pronouncement by the president, by the Health and Human Services Secretary. And I'm so honored and so grateful to be joined for this conversation by Professor Catherine Tan of Vassar College. She's the author of a very important book called Spaces on the Spectrum. And I'm just grateful that we can continue to have this conversation about this pronouncement. Does it have any, true scientific backing? Is there any science-based evidence to support this pronouncement? So thank you so much, Professor Tan, for joining me. I just want to jump right into the deep end of this topic. Again, I want to set the stage with the facts that we currently know. Again, last month, the U.S. Food and Drug Administration announced that it was initiating a label change for acetaminophen to reflect evidence suggesting that use of this drug during pregnancy may be associated with neurological conditions such as autism or ADHD. Now, at the same time, medical institutions caution that an association is not the same as causation. And this debate continues as so many folks are weighing in. In my USA Today op-ed, I expressed the anxiety, the frustration, and the moral urgency that many families feel when facing such uncertainty. I want to get your initial response, Dr. Tan, when you watched that press conference where the president and RFK Jr. made this pronouncement about Tylenol and autism.
Mm-hmm. Well, first off, thank you so much for having me. I think one thing to first address is that at this moment, right now, there is insufficient evidence to support a causal relationship between acetaminophen and autism, right? There is insufficient evidence to support this relationship that people are claiming between Tylenol and autism. Right now, we don't know what the exact causes are. So the dominant understanding among researchers is that autism is caused by a number of factors. Genetic, environmental, biological, but we have yet to pinpoint any sort of single bullet explanation for autism in general, right? So it's still largely a mystery. And so when I first heard this relationship being spouted by the president and the health secretary, for me, it was really shocking because we don't really have the evidence to support this claim. And it's really dangerous from a public health perspective to disseminate, to promulgate these ideas when it's not grounded in science. You know, there are studies that see a correlation, right? Meaning there are studies that are seeing some kind of relationship between acetaminophen and autism, but it doesn't mean that acetaminophen causes autism. And it's important to make that distinction, right? So there could be a number of factors that are complicating this relationship. So that's to create this appearance of one causing the other. So for instance, one thing we know is like parents' age is a risk factor, right? People are having children later in life. And so parental age, older parental age, is one of the risk factors for developmental disabilities and other complications during pregnancy. And so it could be that perhaps older parents, or rather older parents are perhaps taking more Tylenol, or older pregnant people are taking more Tylenol. We don't know yet. And it's really difficult to disentangle these things. So the research is still out. So when I first heard this, I think, my first impression was that it's really dangerous to disseminate these ideas when we don't know for sure. And why it's dangerous is because, this is a drug that is commonly prescribed to pregnant people to manage like pains and fevers during pregnancy. And while there isn't enough evidence to support an acetaminophen autism link, there is enough evidence showing that having untreated fever during pregnancy can be dangerous to the fetus and can increase miscarriage, especially in the first trimester. So that was my first impression when I saw Trump up there sharing these ideas.
It's so frustrating. You use the word dangerous. I've used the word dangerous in interviews how dangerous it is. And it's dangerous because of the reach when a president and a Health and Human Services secretary make statements like that. It carries so much credibility for people. The everyday parent, the everyday person doesn't have the time to go and fact check and look at the scientific research and find doctors like yourself and other scientists who are doing credible evidence-based research. So they hear what they hear, they see the president, and they know the power of that office. And so it leaves those of us who are working on the ground, working in the field with parents, left to try to undo the harm. And it's very difficult to stuff the genie back in the bottle once that kind of comment, that kind of statement has been made, trying to convince folks. I even had doctor friends of mine saying, well, maybe we should give it more time. Well, maybe we should look into it. And one of the things I said, Dr. Tan, is look, in addition to the Tylenol tie to autism, we've got to talk about R.F. Kennedy's consistent statements about vaccines and autism. So which is it? Is it Tylenol or is it vaccines? Because that has also been, we've been fighting in the autism community against these bogus ties to autism and vaccines, which is also very dangerous because the science, again, there's no scientific evidence, credible scientific evidence linking autism to vaccines. Talk about your book and this community of folks that have bought into the vaccine tie to autism.
Yeah. So why are some activists so dead set on connecting autism with acetaminophen, with connecting autism to vaccines? So why is Trump and Robert F. Kennedy Jr. pushing these debunked claims and myths? Why are they squandering millions of dollars on research to scrounge up findings that go against medical, findings, right? Like, or medical research, and the consensus among physicians and researchers is that there is no relationship between autism and vaccines, right? So why are we spending all of our precious resources looking for answers that we already know the answer to? So what we're seeing right now is a shift, right? We have Trump and RFK Jr. Trying to shift the autism framework from being something that is primarily genetic to something that is physiological and environmental. Yeah. So with the dominant way of understanding autism, as I had said earlier, is that autism is likely a combination of genetic, environmental, and biological factors. But this focus on the relationship between autism and acetaminophen, autism and vaccines, shifts the conversation to autism as something that is physiological, that is something cause. And my argument, and what I found in doing research, so for this book, I spent years following parents and doctors who believe that there is a relationship between vaccines and autism. On the other side of that, I also examined autistic rights activists. And so both of these groups were pushing against what medical experts are saying about autism. So I want to focus on that first group today because that's what we're discussing. I argue that when you believe that autism is caused by vaccines, it offers a new pathway towards recovery or a cure, right? So for some parents, the belief that vaccines cause autism actually provides them with quite a bit of hope. For them, they see it as an opportunity to access treatment for their kids, right? So if you believe that it is caused by something like vaccines, then you can begin to do something about it, right? So for parents, this relationship offers optimism. At the same time, it's also quite devastating. So if you think about it, the idea that vaccines cause autism suggests that at some point these parents had a neurotypical or developmentally normal child that was then lost or injured in some way by vaccinations. And that's a really tragic way of understanding your child, right? Of understanding your child's condition. It also brings back mother blaming, right? So parents also feel really guilty when they believe that vaccines cause autism because they consented to vaccinations, right? But again, I want to emphasize that vaccines do not cause autism. This we know. However, when parents believe in this causal relationship, there is a whole industry of alternative and experimental treatments there to serve them, right? So within this belief structure, parents are able to access alternative and experimental treatments. So that can begin with things as small as dietary changes, the incorporation of supplements, and then you can tap into a much larger world of experimental treatments. So when I was conducting this study, parents were trying all kinds of things like parasite therapy, chelation, hyperbaric chamber therapy, stem cell therapy, hormone therapy. Like they were trying, to experiment as much as possible to see if their child was responsive to any of these things, right? And so the hope is, if they can identify a cause, then they can link it to a treatment. But it's not so simple. And these treatments are not scientifically, are not scientifically supported. Some of these treatments are actually quite dangerous and can harm children. But there is a whole industry here that is resting on this belief that, that autism can be cured. And if autism is caused by something we can identify, then perhaps we can reverse it.
Yeah, I had my own experience exactly with what you just articulated, in search of some miracle cure, which so many families do. Uh,
Mm-hmm.
Going to a doctor, and when I look back on this, I am a Harvard trained attorney. I would, if a client told me this story, I would, admonish them in the most aggressive way. But literally, I was taking my son to see a doctor who was working out of her living room. So,
Yes.
okay, red flag number one, right? When do you see a doctor in their living room getting these supplements? Not from a pharmacy, couldn't walk into CVS, couldn't walk into Walgreens, had to send off to some pharmacy in Florida because this was
Yep.
the only place that made these special supplements. And of course, insurance didn't cover it. So paying cash to the doctor, cash to this pharmacy, and then it was the gluten-free diet.
Right.
Uh, so I remember traveling with our son, visiting my brother-in-law, and my son literally climbing up on the shelves in his house trying to get to the bread that we had put on the top shelf because he couldn't have bread, it had gluten. And literally doing this for about 6 months, going to conferences where they offered these alternative treatments and had these hyperbaric oxygen chambers and all of these other kinds of therapies that you just identified. And then finally waking up saying, you know what? If my son had diabetes or cancer or any other medical condition, I wouldn't seek treatment from someone in their living room. I wouldn't go to an off book pharmacy in another state to get him medication. So I really had to evaluate what I was doing. And I saw a doctor at UCLA, Dr. BJ Freeman. She diagnosed like half the kids in LA at this period. And she really, really gave me a good dose of reality about what we were doing and the psychological thing that was happening, about us trying to change our son rather than accepting that his neurological condition is what made him unique, special, and beautiful, and that we needed to incorporate him into our lives in the same way we did with our neurotypical children. And that was really a game changer for me. But there's so many families. As a lawyer, I represent a lot of families, and I've seen people quit jobs, move across the state, mortgage their homes, do extraordinarily financially irresponsible things to finance these alternatives, only to be left frustrated when they didn't work. Following people online, a lot of influencers who say, I cured my kid of autism by doing XYZ. It's a really dark and it's a really dangerous subgroup of predators. Let's just call them what they are, predators that prey on parents' fears, their anxieties, and their just desire to help their children. And that's what is so scary about this now. I want to go back to this Tylenol scare because you mentioned, doctor, that if you're pregnant and you have a fever and you
Mm-hmm.
can't take over-the-counter medication or a fever reduction type medication like Tylenol, that could be devastating to your unborn child.
Yeah, absolutely. And and these are claims that are being shared with the general public when we don't have evidence to support them, right? We don't have enough evidence to tell people to stop taking Tylenol when Tylenol is actually, prescribed for, it is a safe drug that's prescribed to pregnant people to manage like pain and fever, and it's an important resource for a lot of people, and it could be a lot more dangerous to deny them acetaminophen while they're pregnant. And I want to go back to what you had said earlier about the predatory nature of aspects of the autism industry and how harmful it can be for families of autistic children. I it's sort of a nasty loop, right? Like parents want to provide for their children. They want to provide the best care that they can for their children. They want their children to have the best shot at a future. And so, of course, these companies that say they can offer autism treatments, or they can offer specialized testing to identify how to treat their children. These companies are really appealing to parents, but also parents feel this obligation, this guilt, right? It's the guilt that kind of keeps them going, keeps the experiment going longer, because they want to help their child that they see as being harmed by the vaccines that they consented to. So it's really devastating. I think a lot of this comes back to the fact that, being disabled, in the United States is really terrible. Like, we live in a country that does not offer enough support and services to disabled people and their families. And so families, of course, they're going to feel desperate. Of course, they're going to feel very vulnerable. And of course, they're going to want to try to access the best possible resources for their children. And so this makes them vulnerable to predators. So something like this claim about acetaminophen and autism is really dangerous, because you're creating you're potentially feeding into a market that is predatory to parents, but also this is not sound advice. At this time, it is not something that parents should take to heart. And at the same time, it also contributes to a lot of mother blaming, right? Which has always been around. Like, mothers are often blamed for things that are beyond their control, and this is going to be another. It opens up another opportunity for government to target women's bodies.
Yeah, and I can imagine all of the predatory industry moving in, saying to women, when you're pregnant, don't take Tylenol, take this. And a lot of these things that they offer are not FDA approved. Again, no evidence-based science to support the use for the purposes that they are being prescribed. So again, anyone listening to this, just really, we're just trying to hit home the point that what the president and RFK said was irresponsible and not backed by the scientists who have been doing this research for decades upon decades. One thing, Dr. Tan, we in the autism community were a little encouraged about Trump's fascination. He seems to be so fascinated with autism. We knew when he said he's going to be announcing that there's a cure, we knew that was a complete junk. It was going to be based on junk science. But what reforms or what funding would you like to see this administration focused on? I mean, we need to hopefully get them away from this obsession with these debunked theories, but there is some really encouraging research that hopefully funds can be channeled into that would be helpful to the autism community.
Yeah, I think it's important to listen to the parents of autistic children and autistic people themselves directly. Right now, what people need is to feel like they have, for what we need is for autistic people to feel like they have a future, and for parents of autistic children to feel like their children have futures to look forward to. So this means we need more money for support and services, things like education and employment coaching and access to higher ed. So there are many things that can be done to improve people's day-to-day lives. And I think that would be most meaningful for families and autistic people right now, right? So this is where I think resources would be most helpful, is to go directly to parents and autistic people and understand what are they worried about? What are their fears? What are the barriers to self-determination, right? What sort of barriers are they facing? And when I was interviewing autistic rights activists, for many of them, the problem is not autism. The problem is the ableist society that they are living in, that we're all living in, right? Most people are going to experience some kind of disability at some point in their lives. And that's something that we often try to deny. If you're feeling healthy right now, so you don't think about it. But most of us are going to need help at some point in our lives. And so autistic rights activists, what are they worried about? They are worried about access to education. They are worried about having healthcare, right? Continued healthcare, uninterrupted healthcare. They are worried about getting a job. That was probably the biggest issue for my research participants. They talked a lot about having, expertise in something and being educated and trained in doing something, and then being unable to get a job within their field.
Right.
And that's devastating. That's also a loss of really, that's a loss of human capital. We have, people who are knowledgeable and experts and, in their own field, and they're not getting jobs, right?
Yeah.
And that is devastating, because as they said, the problem is not about autism or being autistic, right? The problem is living in a society that is incompatible, or rather in a society that devalues their way of engaging, that devalues their skills.
Yeah, and it doesn't help when we have the Health and Human Services Secretary talk about how horrible
Absolutely.
families' experiences are who have individuals on the spectrum, and what a horrible life that individuals on the spectrum live. That they're pointing to those individuals who are the most impacted, and many of those individuals who've not had the benefit of early intervention services and support along the way. And as I talk to adults who are on the spectrum, young adults, teens, exactly what you said. They want to be accepted. They're not asking to be fixed. They don't see themselves as broken. And that's the way we have portrayed them. Even well-meaning people, the puzzle piece that is used often in the autism community for some young adults that work for my nonprofit. They says, we don't want to be seen as a puzzle that needs to be put back together. We're not, a broken a piece. We're not broken people that need to be put back together. We're whole people that need to be accepted for the unique attributes that we have as individuals. And again, I wish this administration would spend a lot more time listening to individuals like that and understanding the resources that they need, the kind of research that can help them live productive lives, as you said, work in meaningful jobs where they can live independently in apartments and buy homes and buy cars and do all the things that neurotypical individuals do. And those that can't live independently can live semi-independently in homes with assistance. So there's so many things that can be done to assist the autism community rather than going off on these tangents about trying to fix them. And we know this is kind of out of the Donald Trump playbook, where he exaggerates a so-called problem and then positions himself as the only person on the planet that can fix this imaginary problem that he has created in the first place. Just finally, Dr. Tan, I want to ask you, for pediatricians, OBGYNs, or researchers who are listening to this program, what should they be doing in this moment, to act responsibly?
I think it's really important for physicians, pediatricians to spend the time to talk to the families that come into their office. Through my work, a lot of the time, well, for many of my the parents in my research, they turned to rogue physicians who tell them that vaccines cause autism when it doesn't. They turn to these peddlers and quacks when they feel like they couldn't trust their pediatrician anymore. And some of that has to do with how little time pediatricians have with their patients. And so, these families, those that can afford, special physicians like the one you said you saw in her living room, these parents are turning to physicians who do not take insurance, right? Who are cash only, because they're willing to sit down and listen to them. Of course, you have to pay hundreds and hundreds of dollars, and you're not going to have that covered by insurance, but they were given the time, right? They were listened to, they felt heard. And I know, these days it's really difficult for physicians to have that time with their patients, just because of how insurance reimbursement works. But it's important for them to, at this moment when there is so much distrust among parents, that they spend the time to talk to parents so that parents feel heard, and so that parents have the opportunity to ask questions and to have their concerns validated and recognized. I think that's really important for parents to feel like they're not being dismissed. If they to feel that they can ask questions about things like acetaminophen and vaccines, and not feel like their doctors are trying to rush them out, or that their doctors are belittling them, right? So I think it's really important now more than ever for physicians to spend the time that they can to listen to families and to answer their questions in a way that is non-judgmental.
Yeah. Such great advice. Obviously, we need these physicians to treat pregnant people as decision makers and not passive recipients in the process of, securing the best health for themselves through their pregnancy. Thank you so much, Professor Tan, for helping us unpack the tension between research, trust, and lived experiences. Again, her book is Spaces on the Spectrum. Pick it up wherever books are sold. Such an important book for the autism community, and for those who are trying to understand more about the autism community. Again, thank you for joining me. And I just want to say to our viewers, this matter demands your critical attention, your advocacy, and your compassion. As I said in my op-ed piece, if Tylenol causes autism, which we know it doesn't, but if that's the statement that's being made by our administration, families like mine, families like yours, families who are dealing with autism, we deserve the truth and we deserve justice. Every parent wants the same thing. They want to do right by their child. And it's on all of us. It's on the researchers, it's on the scientists, it's on the policymakers, and those who have been entrusted with our health to make choices that are clear, to make statements that are clear, and to follow the science. And, when there is uncertainty, we can't allow the quacks, we can't allow the disinformation, we can't allow the conspiracy theorists to fill the void and to somehow co-opt the narrative. And that has been done, unfortunately, on vaccines. And if this administration has its way, it's going to be done with respect to Tylenol and other drugs that have the ingredient that Tylenol has. And it's up to us who know the difference to not allow the narrative to be co-opted and not allow the narrative to take control and create the kind of fear and chaos that we've seen over the last couple of weeks since this pronouncement. I just want to encourage parents, find a trusted physician, a trusted doctor, find a trusted friend group, a trusted parent group, a trusted organization in your community or online, and let that be your source of strength. Let that be your source for reliable and trusted information. Don't allow every little story that pops up on your social media feed to cause you to doubt what you know to be the best way to provide support and help for your child on the spectrum. And please visit Special Needs Network. Our website has so much information. We have connections with credible scientists at UCLA and other reputable universities around the country. And we endeavor to provide parents with that source, to be that source of trusted information. And I encourage you to lean on us, to connect with us, and to let us help you on your journey. I'm Areva Martin, and this has been the Special Report. Until next time, stay informed and stay empowered.
Calling all BIPOC college students, recent college graduates, and clinicians. Here's my story about CORE, a unique workforce development program that is changing lives. My brother is the most caring person you'll ever meet. With his autism diagnosis, my family had to fight to make sure that the resources he deserved were available. That's why my goal has always been to help children with developmental disabilities and give them chances my brother may have missed. So when I heard about the CORE Fellowship, I knew immediately it was for me. The fellowship opens doors for myself and others like me. They offer training, a stipend while you're learning, job placement, and they'll pay up to $10,000 of my student loan debt. The CORE Fellowship is going to allow me to achieve my life's purpose. They care about me, so I can care about others, like my brother. Visit the website to learn more about the CORE Fellowship. Discover your core passion, your power, and your purpose. Apply today.